Hi guys, and welcome to another Hero of the Week. This week's hero is an NHS nurse called Karen who goes by the name of Stormzy on Twitter. She called into LBC when Sajid Javid was hosting. Javid is a former Secretary of State for Health and has been one of the loudest voices for privatisation of the NHS. He some time ago suggested that patients should be charged for both GP and A&E visits. The reason? The current model of the NHS is unsustainable. The problem is that his party and government have made the health service unsustainable. But back to Karen. She truly held his feet to the fire over a number of issues, including PPE contracts. Have a listen to this.
I've worked as an emergency nurse for over 30 years. I'm now left disabled by long COVID because, you know, while we were busy on the front line, putting our lives on the line, and by the way, I lost 3 friends who
sorry
died
to hear that. Very
trying
sorry
to
to
save people. But your government was busy doling out PPE contracts to all their mates, most of whom didn't produce a single piece of PPE, some of whom PPE that was produced is now costing us millions to burn. You have deliberately set about to defund and destroy the NHS from the moment you took office in government.
Well, Karen, let me first...
Prior to you taking government, working in A&E, we hit the 4-hour deadlines. We had the lowest waiting lists in history. We had the highest patient satisfaction, and then you guys came in and dismantled it and saw an opportunity for each and every one of you, for you to make money out of it and for you to get your friends richer out of it off the back of the people who are working on almost minimum wage. We've got doctors on £14 an hour, nurses that were starting on £12-13 an hour. And for what?
Karen,
Well said, Karen. And before we hear from Sajid Javid, there's a few things to add to this. When it comes to PPE, the government had commissioned a report into an exercise into how to deal with a pandemic, Operation or Exercise Cygnus. Now, the findings of Cygnus was that the government did not have sufficient PPE, and whatever PPE they did have was out of date. It needed to be replaced. What did the Tories do? They ignored it. And then when the pandemic arrived, they were ill-prepared. And they ignored the pandemic at the beginning. Boris Johnson, of course, did not attend very important COBRA meetings, and we saw the results of that. But when it was necessary to have the PPE, instead of actually reaching out to companies who produce it, they issued contracts to their mates. Companies were set up overnight, and those companies won contracts to produce PPE, and in many cases they didn't produce it, or they ordered it from China, and this PPE was not fit for purpose. That's why a lot of it is being burnt at the moment.
let me thank you. I've heard you loud and clear. Thanks for sharing those views. First of all, let me say that I want to thank you for your service, and I'm sorry to hear about your 3 friends during the pandemic. But when it comes to the NHS, I'm not sure if you heard everything I said earlier, but spending on the NHS, even long before the pandemic, is at the highest levels ever in real terms, in cash terms, no matter how you want to measure it. We spend more than most other comparable countries on healthcare in this country.
And where does it go? That's the question. First of all, there are 2 questions. Is it enough? And where does it go? Is it enough? It seems to be not enough. And where is that money going? It's going into the private sector. Because if you want to hire a nurse in the NHS, it's, as was pointed out here, we're talking about £12-13. But if you can't find a nurse, then you have to recruit agency staff. And how much do agency staff cost? Well, we're talking about £40 an hour. This is where the money is going. This is why the return on investment is so poor. Because so much money is being sucked in by the private sector. And the return is pretty much the same. You're still getting a nurse. This is not the way to do things. But the Tories don't care about that because their friends are donating to the Conservative Party and getting something in return.
Yet I think most people would agree we're not getting the kind of outcomes that we'd want to see. And you mentioned the issue about PPE, and I get that what you're saying, but I can't agree with everything you've said about that, because I think you have to think back to the start of this pandemic when PPE was absolutely necessary. Every country in the world had a shortage of PPE.
There were British companies, and I've commented on this before, there were British companies who were ready to produce it for the NHS. They had reached out to government and they had not received a reply. While at the same time, friends of Conservative MPs were setting up companies literally overnight, and then they were given contracts. Businesses who had no history of producing PPE were hired, while companies who had a long history of producing PPE were ignored.
And I think people would have expected their government at the time to do everything they can to get their hands on it. And you're right, they may well have brought too much, and you may well have to destroy that now. But I'd rather have a government that's buying too much than having too little.
I don't think you're listening to me, Sajid. The stuff that you were providing was plastic, useless rubbish, gloves that you would put your hands through, aprons that were the thinnest I've ever seen. The PPE was shocking. It was not fit for purpose for most of the time, and it left us open to vulnerabilities. It's left me disabled, basically housebound now. I've gone from being a busy, working 12-hour shifts in A&E, being out on my bike, going out kayaking, out with my kids, to someone who's now left in my home because your government failed to prepare me, to protect me. And also, you are also refusing to recognise it as an industrial illness, which it is, because I wouldn't have got this if I hadn't have been facing COVID every single day.
And that's so true. We saw at the very beginning of the pandemic, doctors and nurses wearing bin liners as a form of protection. Why? Because, as I said before, exercise sickness explained to the government, you need to invest in proper PPE. You need to buy it. You need to replace the out-of-date stuff. But the Tories don't care about spending money for the public service. They only care about funneling money through the public service into the pockets of their donors. And that's the consequence of that. You can apply it to every sector. Wherever there's public money, it's going to a donor. And in some cases, the impact on people's lives is minimal. But when it comes to the NHS, the impact on people's lives is fundamental. Doctors and nurses working close to minimum wage, putting their lives on the line, and expecting government ministers to have their back, to be there to protect them. And instead they're looking over their shoulder going, how much money can we make out of this? Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.